Good morning. We will give 2 more minutes to let anyone who's behind join us. Hello, everyone. Thank you for joining us today for our ALS Webinar Wednesday series. My name is Alejandra Herrera, and I'm the Marketing Coordinator for ALS North America. I will be facilitating the webinar today. If you're having technical issues with our webinar platform or you have any questions, please use the chat function at the bottom of the screen. You can also select the hand icon to notify me of your status so I can assist you. All questions regarding the webinar material will be answered at the end of the presentation. Our presenter today is Dr. Rania Ibrahim. Dr. Ibrahim is a clinical director at ALS. She has been working in the field of safety and clinical testing for cosmetics, personal care products, and OTCs since 2011. She holds a doctorate degree in pharmaceutical and cosmetic sciences and a master's in biomedical engineering from the University of Cincinnati. Today, Rania will be discussing an introduction to clinical testing. Rania, I will now turn it over to you.
Thank you so much, Alejandra, and thank you everyone for taking the time to come and listen to me speak. We can all agree that last year COVID is equivalent to like 30 years. So really, it hasn't been 10 years since I've been doing this. It's like, I don't know, let's just say 40. Anywho, I will be talking today just a really brief introduction into clinical testing. We'll start off with safety and then talk about some of, just the basic claims that we come across in terms of efficacy. And I will be happy to answer any questions at the end of this presentation. And obviously, if you have any additional questions after the talk, feel free to reach out to me. So I am based in Phoenix, Arizona. We also have facilities in Torrance, California, and Brazil, as well as New Jersey. Actually, New York, sorry about that. So we definitely have quite an array of clinical sites in order to be able to accommodate all sorts of clinical testing. So in terms of safety testing, the most basic safety test is the RIPT and the primary irritation. So the RIPT, as many of you know, is a 6-week test. This test is a really good indication of whether your product is causing irritation, and in addition to if it is causing an allergic reaction. Primary irritation is a really short test. It's usually just a 48-hour patch. It's the most basic test that you can do. There are certain kinds of products that, because of the level of irritants or the nature of the product, that really can't be tested on a full 6-week test because it's so exaggerated. You take the product, you put it under a patch, and usually then in that case, we will recommend a primary irritation. And you can use these tests to make claims like dermatologist tested or dermatologist reviewed. It's actually the least expensive way of being able to make the dermatologist tested claims. For cumulative irritation, It's a really exaggerated irritation test. And this is actually a really good test to help you identify differences between products in terms of irritation. So let's say, for example, you had a formulation and in the market, you had a lot of people complaining about irritation while using the product, and you reformulated and you want to measure up how irritating or less irritating the new formulation is versus the older one, or in comparison to a competitor. This would be the test that would give you that indication, because of the fact it's extremely exaggerated application where you are essentially wearing a patch for 14 days straight or 21 days. A lot of people ask me which one is better than the other. It's, in my opinion, and there's also a lot of literature that indicates that the 14 days is really long enough for you to identify these differences in irritation, and that, you know, you really don't have to go forward with a 21 day. So those are the kind of safety tests that are not a true use. And by not a true use, what I mean is you're not using the product as is indicated to be used. You're taking the product, putting it on the back, and you're putting it under a patch, which is not what we do every day. We don't use product and wrap ourselves in saran wrap. So the other kind of testing, which is the safety and use, is more indicative of true use. So let's say, for example, it's a facial serum. You would give it to individuals to use for a period of 2 to 4 weeks. They would keep a daily diary and record their sensory indications of whether the product is irritating them or not. And then they undergo an assessment for visual signs of irritation, both before they use the product and after the 2 or 4 week use. So this is a really good test for products that can't be tested on RIPT. Like, let's say, for example, a product that has really high alpha hydroxy acids, or if you have a product that was tested on RIPT and then it went into the market, and then all of a sudden you had someone destroying you on social media because the product was really irritating them. This would be a good test to employ in order to get that kind of data that is more closely associated with real use. Because at the end of the day, the skin on your face is not that similar to what is happening on the back, especially for people who identify as sensitive skin, which is the next point. And for products where you're trying to make claims that the product is safe to use for individuals who have sensitive skin, the way that you would do this is, the best way to do this would be to safety and use test. There are some RIPT studies that subjects with self-perceived sensitive skin are selected and placed on these RIPT panels. It's one way to do it, but in my personal opinion, if you really want to understand how products are reacting with individuals with sensitive skin, the safety and use is the best way to go. And then there are the additional tests like phototoxicity and photoallergy, which are not as common as the other tests that I went through just a few minutes ago. The next type of safety testing is the ocular testing. So if you're looking to make claims that the product is safe to use around the eye, there are 2 ways to go about doing this. You can use in vitro. In vitro really is more indicative of what happens if it goes inside the eye. But if you really want to make claims that it's safe to use around the eye or safe to use for people who wear contact lenses or people who have sensitive eyes, the way to go about doing this is the safety and use, where subjects are given the products to use for a period of 2 to 4 weeks. They come in, they get an eye exam at the beginning of the study, at the end of the study, and again, they keep a daily diary to record any sensory reactions to the test product. And for products where you are looking to make no tear claims or no stink claims, similar to what you would see for like baby products. This would require individuals to actually, the product would actually be directly inserted into the eye. And again, there would be eye exams done beginning and after installation, and then depending upon the sensory reactions, the product would either pass or fail the eye sting portion. We then come to efficacy testing. There are a plethora of claims that you can make. We're just really going to touch upon some really basic ones. So the first one would be the hydration. There are various instruments that can be used to measure hydration. These instruments really just look at surface hydration. So they're superficial assessments looking at what's happening in the stratum corneum. If you're really looking to make deep hydration claims, you need to look at deeper layers in the skin to look at the NMF factors, and that is actually extremely expensive to do because you have to do confocal Raman, and that is a really specialized instrument and requires very specialized analysis. So most people will just go with the typical hydration claims that come from the corneometer, the SkyCon, and that's the kind of claims when you see, 100% increase in hydration, 120%, et cetera. The next really typical assessment that we see is the skin barrier function. So if you think about the skin as almost like a Band-Aid, and the skin prevents things from, entering the body and also from things escaping from the body. So the more disrupted your skin barrier is, the more holes you have. So if you constantly wash your hands or you use abrasive products, what would happen is that these products would cause these like miniature tears to occur in the surface of the skin. And so what we're essentially measuring is how much water is escaping from the surface. And that is indicative of how damaged the skin is. So you can use this assessment to look and make, skin barrier claims, also repair claims where we intentionally damage the skin by tape stripping. And then for products where you're trying to make gentle claims, like for exfoliants or harsher products, and you're trying to say that the product is not as harsh as other products or is gentle to use on the skin, this would be the assessment that you would use. The next most common claim that we see with anti-aging products is firmness and elasticity. And the cutometer is essentially an instrument that has a vacuum in it. And when you place it on the surface of the skin, what happens is that the vacuum turns on. And what we measure is the force that's required to pull the skin into that vacuum. And that correlates with how firm the skin is. And then once the vacuum turns off, it measures how quickly the skin bounces back to its original position, and that correlates with elasticity. And a lot of questions I get sometimes with firmness and elasticity results is, why did my firmness work and my elasticity didn't, or vice versa? And I always like to compare it to a mattress. When you get a really firm mattress, you forego that bounciness, elasticity, and vice versa. So sometimes it's actually quite common to see that both of them are not going in a positive direction. And so that's, probably one of the most typical things that we see. We do see that sometimes both of them work. But if you do happen to see in your results that one's better than the other, that's usually why. It's just if you get really firm skin, you forgo that elasticity. The next assessment that we see quite frequently with products like masks and exfoliants and scrubs is the exfoliation, which is dry, flaky skin. And essentially what you see on this left-hand side is a desquam, which is just a circular adhesive disc. And it is placed on the skin, and the adhesive then removes the flakes. And then there's an instrument that measures how many flakes were lifted upon touching the surface of the skin. And so with these exfoliation type products and claims, what we're doing is we're obviously taking the assessment before the use of the product and then after, and what you're hoping to see is that there are less flakes after the application of the product that's being tested. And this is not to be confused with cell turnover, which is the natural shedding of, the squam cells that our body undergoes over 4 to 5 weeks. Just like a snake sheds skin, we just don't do it in the same way as snakes. We can't really visually see it. And so cell turnover is really assessing how quickly the skin is turning over. And what we do is we do these on the inner forearms, where we have one arm that's the treated site, the other arm is the untreated. We dye the skin with this fluorescent stansyl chloride, and then what we do is we look at how quickly the fluorescence is being removed over time. And what you're hoping to see, obviously, is that your treated site is losing fluorescence much quicker than your untreated site. Skin texture is an assessment that we see a lot with anti-aging, but also moisturizers, where you're hoping to see a smoothing of rough skin. And there are various ways that you can assess it. The VisioScan is a two-dimensional assessment of skin texture, whereas the Primos is a 3D analysis of texture, where you can actually look at depth and more topography versus the VisioScan. And both of them serve different purposes. Typically, you'll find that 3D analysis is a little more expensive than 2D analysis, and that's why sometimes a lot of people will just rely on the 2D analysis. Skin density. Being in the personal care and cosmetic world, we have to be really careful about the kind of claims that we make so that we don't go into drug territory. I know a lot of people like to talk about collagen synthesis and increase in the dermis thickness. And the way that we get around talking about that without going to drug territory is talking about skin density. And the ultrasound will essentially measure the thickness of the dermis, which correlates with collagen synthesis. So if we are seeing a thickness in the dermis, we can, loosely correlate that there's an increase in collagen synthesis. But the way that we go about talking about this is just really referring to it as skin density. Keep the wonderful FDA far, far away. Sebum output, various ways of looking at it. It's the same technology. It's just the VisioScan gives you a visual assessment of what's happening in terms of it's a good marketing tool. But essentially what's happening is you have a foil and you place it on the skin. It soaks up sebum that's seeping through the pores. And then what happens is that the instrument measures the percentage of sebum that is collected on the surface. And obviously what you're looking to see, hopefully, is that there is a reduction in that output. These are really good. We use this assessment typically for a lot of our acne studies, also for makeup, where you're trying to make a claim that the makeup is mattifying or is controlling, not shine, but actually controlling the oil control. So, or also for washes. So this is a good tool to look at making those kind of claims. You also have skin pH. Claims that your product is not affecting the pH, so before and after. And then with the glossimeter, we're looking at skin shine. So this is a really good tool for products that are like foundations and powders that are intended to mattify and cause less shine. So this would be the instrument that we would use. And typically for those kind of studies, they're long-term studies in terms of, not long-term, they're short-term, but over an extended period of time, so maybe 6 to 8 hours, even 12, where individuals are kept in the facility for that length of time. And what we do is we measure the shine over that time so that you can make claims that, you know, it maintains shine overnight, or you know, for 8 hours, wherever that claim might be. Skin color. So this is the provometer. We use, basically what it does is it measures the pigment. We use this frequently for measuring skin redness. We also use this instrument for making claims where long wear claims that, you know, the foundation isn't coming off over a certain period of time, or the eyeliner, or whatever, you know, whatever makeup that may be that you're like trying to make long wear claims, and also color matching. A lot of times in the development phase, you're trying to match certain products with specific skin Fitzpatrick skin types. And so this would be a good tool to assess whether the product is matching specific skin tones as well as you would like it to. This is just another, just an example of what the Primos 3D analysis looks like. You can use this for not only the textures we saw previously, but for fine lines and wrinkles. So if you are looking to make depth claims that the depth of the wrinkle or the depth of the fine line improved over time, you would have to do 3D analysis. I think we're all familiar with the Canfield busiest CR, which is a fantastic tool for taking images. The great thing about this instrument is the standardized lighting. And also the fact that you can align the images from one interval to the other very well, because you can pull up images from your baseline, which is as a ghost image, and then align the individuals at the following intervals to be able to fit perfectly with the initial assessment. And these are just a few examples. They're different standard lightings, and they're used differently for different types of analysis of expert grading, whether that be shine or perhaps skin tone, redness. You can also look at UV damage, which is not visible to the naked eye, and also pore analysis. The color face is another imaging that can be similar to Visia. This is it's the same technology in terms of the standardized lighting and the being able to have each of the intervals in alignment with one another in terms of the position of the individual. The nice thing about this particular image with the color face versus the Canfield Visia is that you don't have the forehead prongs and the chin rest. So this is a nice tool to use if you just are looking to only have the face and not have other things in the images besides the ear lobe structures. So there's various image analysis programs out there that can analyze things like fine lines and wrinkles, hyperpigmentation, the age, photo damage, pores, redness, skin brightness, and porphyrin. These tools are great in the sense that they allow you to select a specific area and to keep the area of analysis exactly the same in terms of size and positioning. So you know you're going back to the same spot each time. This is an example of analysis of fine lines and wrinkles. The different colors correspond to the different size and depth of, not depth, but different size of the wrinkles. It's a 2D analysis. This is an example of assessment of hyperpigmentation and also UV damage. And also you have the capability of tracking specific spots to see if the intensity of the color as well as the size is changing over time. I usually recommend for hyperpigmentation studies, longer length studies, at least 8 to 12 weeks. It's usually how long it takes for hyperpigmentation to improve over time. You can definitely see changes in fine lines and wrinkles in shorter periods of time, like 4 weeks. But I don't really typically see that with hyperpigmentation. This is just an example of the pore analysis and the porphyrins, which is loosely correlated with acne. And then there's also the digital photography. So for body parts that wouldn't fit into, unless we were super flexible, fit into the Visia booth or even the color face. And you can do assessments for hair growth, cellulite, stretch marks. We do a lot of hand studies and things for the neck and the décolletage area. And then as far as makeup evaluation, there are a variety of different analysis. I think the new one that we saw since COVID is the mask, that it is a mask wear per se, that the masks, that the product isn't coming off with wearing of masks, but long wear, transfer proof, smudge proof, the water resistance. We can also look at the volume and length of curls, as well as just the density of the lashes. If you're trying to say that your product is increasing the eyelash growth, and we talked about the mattifying and the shine control. The cheapest kind of studies that you can really participate, that you can employ for trying to make efficacy claims are consumer use studies, where there's really no assessments. It's just really the opinion of the participants. I will say that most of the marketing that we see out there, and your strongest data comes from questionnaires and consumer use studies. When we see things like, 90% of women felt that their texture of the skin improved, it's indicative of the fact that it's coming from a survey and opinion, and not so much the actual quantitative assessment. Because quantitative assessment, you can have clinical relevance in small percentages. So, an improvement of 5% in fine lines and wrinkles from a clinical assessment perspective is valid and is actually very decent. However, to a consumer, 5% is almost like meaningless. Like, what's 5%? So we find that, these consumer use studies and these questionnaires tend to be the driving force in a lot of marketing. And then your OTCs, acne studies, making non-comedogenic claims for acne-prone individuals, various ways to do this. You can either do the comedone count, which is the facial count. So they use the product on the face and you count comedones before and after use of 4 weeks of use of the product. Follicular biopsy is an exaggerated way of looking at making non-comedogenic claims, non-acnogenic claims, where the product is placed on the back under a patch. This is a really cost-effective way of making non-comedogenic claims if you have multiple products, because you can test multiple things on the back, versus with the facial count, obviously you can only use one product at a time. And with that, I have come to the conclusion of my presentation. I want to thank you all for your participation in this. And the last time I did this last year, I had a coughing fit. So I'm just grateful that I didn't have another coughing fit this time. But with that, I appreciate all of you, and thank you, Alejandra, and I will pass it on to you.
Thank you, Rania, for your presentation and your expertise on this topic. Before we begin the Q&A, I would like to ask everyone to take our survey. You can find the link in the chat section. I will give everyone 2 minutes. I will also give everyone a few more moments to type in your questions in the chat. In the meantime, I will review some brief notes. This webinar presentation has been recorded. All participants of this webinar will receive a follow-up email once the recording is available to view. We also post our webinars on our ALS Global website and our ALS YouTube channel in the webinar playlist. Also, please follow our company page on LinkedIn as we post announcements and registration links to future webinars and other resources and updates. Well, it looks like we do not have any questions at this moment. I would like to thank everyone for attending this webinar today, and thank you, Rania, for the presentation. And if you have any questions, please contact Rania or myself, and enjoy the rest of your week.
Thanks so much. I appreciate you all.
Thank you.